Our next speaker is Wendy Maurer with the Coconino County Environmental Health. And Wendy's presentation is, What do you know about body modification? We'll go ahead and play her bio real quick.
Wendy Maurer graduated from NAU in 2002 with a Bachelor's of Science. She joined Coconino County 12 years ago, engaging in different areas of public health. During this time, she obtained her REHS and now works in the Environmental Health Department. She has a passion for body art, and in 2021, she joined the NEHA Body Art Committee.
Perfect. Wendy, if you're ready, feel free to turn on your camera, turn on your audio, and share your presentation.
Good afternoon. Oh, my background's really dark. I will just go ahead and present. When I'm presenting, I will do, I'll just turn off my camera. Thanks everyone for joining me. I realize I'm in the afternoon slot right after lunch. I also want to put a disclosure out there. Some of the graphics and pictures I have are a little graphic, so if you have a sensitive stomach, just be warned. All right. So body modification. What do you know about body modification, and why should it be everyone's concern? Let's give a little bit of background in regards to body art. And kind of ancient art has been around for thousands of years. In the recent past, body art was negatively associated with gangs, sailors, etc. Currently, if we go way back, we can look at some of different cultures and things like that, where indigenous people use body modification as a sign of beauty. Mainly this was done, I would have to say, a lot of females. Tattooing was done more commonly on males back in past centuries.
Oh, sorry, Wendy. Are you sharing your screen?
I am. Can you not see it?
No, we can't.
Okay. Let me see. All right. What about now?
Yes, we can see it now.
Thank you. All right. So these are kind of video. Thanks for bearing with me. I'm not the best at technology. So now in body art, some things haven't changed. Now body art and body modification, which is what it currently is called, is more widely accepted. It's also associated with many different types of people. Look at our pop culture, for instance, Post Malone, Justin Bieber. All of these artists have numerous tattoos, anywhere from their face, their head, toes, hands. So it's a lot more widely accepted, as I was saying earlier. So let's talk about some of the psychosocial reasons. So the reasons people modify their body: it would be a rite of passage, trendy. It's a documentation for milestones, different events that happen in people's lives. It's a self-expression. It also sets people kind of apart from mainstream society, and it also the desire to be different. Let's talk about how tattoos work. So tattooing in body modification is probably the most popular thing. So tattoos are applied using a small electric device. It's kind of like a sewing machine. So 1 to 14 needles are kind of grouped together in a rod. It's called a needle bar. And then after you prep the skin, the artist dips these needles into a small amount of pigment or ink. All of the inks are placed into disposable cups, and then they're discarded after the procedure. The machine then is guided over the skin, and the needle bar goes up and down over the surface of the skin. So it only sticks out a few millimeters. This prevents the needle from going too far in the skin. And then in the next slide, I'll show you kind of a picture in regards to where the needle is placed. Once the tattoo is completed, the tattooist usually applies like an antibiotic cream or ointment over the area and a sterile bandage. DermaShield is also something that has gained like notoriety within the industry, and I'll talk a little bit about that later on. Aftercare is provided to the client. This kind of tells them how to care for their procedure. So here is a picture of how the tattoo, how the needles or the needle bar goes into the skin, what surface layer it is. Let's talk about different body modification styles. So as I said, currently probably the most popular is tattooing. There is scarification, branding, suspension, implants, tongue splitting, or chemical. And I have photos of all of these. So we'll kind of have a further dive into each one. So as I said, tattooing was placing pigments under the dermal layer of the skin. Piercing is anything from ears to genitals and everything in between. Permanent makeup has definitely gained as well a lot of notoriety within the industry, especially with microblading, which is like thickening of the eyebrows, anything to permanent eyeliner, lip liner. All of these are quite popular within the industry. Microblading, as I spoke of earlier, is kind of thickening of the eyebrows, and it's very similar to tattooing. And in the bottom picture is a picture of a needle bar. Branding currently is not allowed in Coconino County. Currently, right now in Coconino County, we're the only county within Arizona that is regulating body modification studios. However, I've heard buzz that other counties might adopt or start enforcing. So it's something to look forward to. Branding is just burning of the skin. Scarification is going to be cutting away of the skin. You can see in that bottom picture is actually chunks of skin that have been removed from the back. Looks very painful. Stapling is another way of modifying or modification of the body. Currently, I don't see any stapling being done. Implants and microdermal implants. So in 2012, a variance was passed, at least in Coconino County, to allow this to occur within the piercing studios. And that is placing a surface anchor or a piece of metal in the dermal layer of the skin. Suspension, Jane's Addiction is really into suspensions at their concerts. Currently, suspension is not allowed within our county. So body art, it's from a public health point of view. Why do we care about this? Body art's highly, widely unregulated within the United States. The implications are that diseases can spread if the body art operators don't understand good hygienic practices or have like an understanding of the microbial world. Currently, Coconino County, we inspect over 18 establishments, and we have 3 actual facilities that are licensed for piercing. So why should body art be regulated? It's not surgery, right? So body art is a very invasive procedure, and invasive procedures disrupt homeostasis that can introduce bacteria, viruses into the body, etc. So it's really important that our operators kind of understand not only kind of how infectious disease works, but also are aware of the bacteria or pathogens that could be introduced during these procedures. For instance, it would be like going to the doctor's office and say, let's say I want a nose job. And the doctor is like, this new associate is going to do this procedure. And the associate had only ever watched the doctor do the procedure. So this is why it's something that I'm very passionate about. And also, I think it's really important that we pay attention to and also regulate this industry. So one of the roles of public health is to prevent the spread of infectious disease. On the NEHA committee right now, we're currently trying to modify the new code, which is the 2021 code. And then hopefully we'll be able to adopt the new code, as in food code, same thing. Everything goes out to the industry for feedback, and then we're able to adopt the regulation and adjust accordingly. So currently, Coconino County, we were the first county in Arizona to adopt this regulation. So let's talk about a little bit about the body code regulation. So currently, all body art establishments and operators need a license. They do that by applying with the county. We also dive into sanitation and sterilization procedures. So we're looking at instrument sinks, autoclaves, and ultrasonics. So this would be for operators that do not use 100% disposable, which really is where the industry is kind of going. Also, the preparation and care of the body art area. So like, how are they preparing the area for the procedure on the clientele that is getting it done? Also, are they using single-use items like razor blades, linens, drop cloths? A lot of the equipment that body art artists use is similar to dentistry. I thought that commonality was pretty interesting. So here is a clean room, the rooms within the facility. So currently, our code reads 45 square feet per operator. However, the new code coming out states 80 square feet per operator. That gives a little more room per person for any type of bacteria that aerosolizes. Areas need to be screened for privacy. Not only do people get tattoos on arms and legs, but they also on their private parts. So they need to have some area for privacy. Rooms have to be well ventilated, especially for operators that are doing branding, which I said currently is not allowed in Coconino County. You have to have a type of ventilation system because you're burning the skin, as well as 100 lumens, which is how we judge light in each workspace. We don't currently allow any type of animals due to animal dander. But there also is an exception for service animals, as we all know, same thing as within food code. One lavatory is required with the separate hand sink, as well as one utility sink. And then all operators must have covered trash cans and sharps containers. So currently 2019, the model body art code, as I said, we're kind of updating regulations all the time. You need to have client records and retention. So this is going to be a release form. So all of the operators need to make sure they provide a release form to all of the people they're doing the procedures on, including a photo ID. The records have to be kept for a minimum of 3 years. I believe that kind of coincides with the statute of limitations. Public notification requirements. So that's going to be an aftercare. So as in any type of big procedure, you need to know how to take care of your procedure area. Spore test by a third party, that's going to assure sterilization. So that's going to be in the operators that are not 100% disposable. for the ones that are actually using reusable equipment, not including the needles, are not allowed to be reused. All facilities go through a plan review, and same thing as like in a restaurant, we look at all the foundational things, floors, walls, ceilings, and then also let's look at some prohibitions or illegal. Homemade tattoo guns. Believe it or not, I have actually seen some tattoo guns within some facilities. You can't be under the influence of anesthesia, drunk, high, all of those things. And if you are tattooing minors, you have to have parental consent. So all of those things are required. So here is a picture of, I Googled a homemade tattoo machine. It's made out of like a Bic pencil, which is very scary. Also, back to revisions, let's talk about, there's always added definitions and clarifications. For piercing, their actual jewelry requirement and standards. So all jewelry has to be approved materials like steel, titanium, solid 14 karat gold, and all of your jewelry in which you're being pierced with have to be internally threaded. So it's going to be the picture on the right-hand side, which means it's going to be smooth. So after the piercing is complete, when they're putting the jewelry in, they're not taking an external threaded type of jewelry and then pushing it through, pulling all that bacteria through the actual wound that they just created. Ear piercing, so stud and clasp guns. We all know what Claire's is, or most of us should, in the mall back in the day. So Claire's is the classic stud and clasp guns. It's single use. They just punch right through the earlobes. Currently, they're only allowed to do that. However, Claire's has wanted to expand with a stud and clasp gun into the nose. So that's been, I don't know anybody who's done it currently, but I would like to know how it went. Also, peel-a-packs. Those are going to be all of the equipment that has been sterilized in our ultrasonic or Statum, and then it's heat and pressure combined, so it destroys spores. All of the peel-a-packs come out of these equipments, and they'll have like a little indicator that the sterilization was done properly. All of this equipment has to be spore tested by a third party, which means they send away test, and the tests come back to tell them if the equipment is properly sanitizing. Everything in the rooms need to be well ventilated and 8 inches off the ground. So you can't store those peel-a-packs, which are sterilized, near water lines as well. So here is an example of a piercing room. As you can see, all of the small little drawers that are labeled, those are all our peel-a-packs that are kept up off the ground. It's sterilized jewelry. There's only a hand sink within this facility. And so they do a really good job. Everything's sterile and put away. Any facility that provides body art services, as I said earlier, needs to be licensed to do so. And then same thing, currently our body art operators have to have a health card. So they take an exam, just like as in a food handler or food manager. They also have to have an annual bloodborne pathogen certification and have either a hepatitis B vaccination or a waiver. So here is an example of a facility. This is an open concept studio in Flagstaff. And as I said, they have privacy partitions to put up in between in between the operators' workstations, as well as they have all their operator cards posted on the wall. That's all considered flash art. So I just wanted to show everybody kind of what a studio looks like. We're kind of moving away from an open concept studios to more closed off, where each operator can actually close the door. They're in enclosed rooms. It tends to be a more sanitary way of doing body modification, although open concept studios are still very popular. So pathogens of concern. So this is really important as we're all mostly in environmental health. Bloodborne pathogens definitely of concern when you're tattooing are going to be HIV, AIDS, hepatitis C, Hep B. We're going to look at all our skin infections. So skin infections caused by staph, strep, pseudomonas, mycobacterium, and other complications. So this is going to be the slides that have really great graphic photos. Some documented ailments associated with body art also are going to be gingival recession from oral piercings, gangrene, mitral valve endocarditis, keloid formation, retinal vasculitis, polychondritis, which is going to be your cartilage trauma. So now here's some pictures of kind of what these ailments look like on the skin. So granulomas is going to be tissue injury due to, it could be poor hygiene. It could be poor aftercare. It also could be uneducated artists performing the procedure. Here's infection. It also is important that when you are getting these procedures done, that you take care of them, as in any type of kind of surgery. It's important to make sure that the areas are kept clean and free from infection. Let's talk about some tattoo deaths. Getting really morbid here. 31-year-old man from Texas got a tattoo on his right calf. He went swimming in the Gulf of Mexico. In the aftercare, it is disclosed of how soon you should enter a body of water, especially one that's not chlorinated. 3 days after swimming, he was admitted into the hospital with severe pain in both legs. Quickly, he developed a purple patch on his right hip. So symptoms included fever, chills, redness around the tattoo. And then he actually he died from septic shock. So he tested positive for Vibrio vulcanophus, bacteria commonly found in coastal oceans, and that he died 2 months later. So that's why it's really important to take care of the procedure area after you get something done. So polychondritis, this is our cartilage trauma. This is just from a piercing of the ear. This is keloid formation. So this is scarring. So this area becomes red and purple, like bulbous from the scars form around the wound. So like actually where the procedure was done. And this looks very painful. Oral piercing problems. So you can have infections from gums, from piercing. I didn't sign up for an infected tongue. It's all fun and games until you have gum recession. Also mitral valve endocarditis. So here is a sclera tattoo. As you can see on the right-hand side, one of her eyes has had this procedure and the other one has not. So all of this changes the appearance of how we look. The picture on the left-hand side is definitely a sclera tattoo gone wrong. Her eye is infected. She can hardly open it. I would imagine she probably lost vision in that eye. So let's talk about inks. So many colors, anything from fluorescents and whites to every color in the rainbow. So what don't we know? The FDA does not approve tattoo inks to be injected into the skin. And then tattoo inks also do not disclose ingredients. So inks can contain heavy metals, lead, iron, cadmium, magnesium, aluminum. Organic inks still contain metals and other stuff. So these could all contain heavy metals. And the tattoo inks are not sterilized before being placed in the skin. So a lot of people have allergic reaction, especially to tattoo inks. I have a friend who gets tattooed and she had a bunch of red in her tattoo. Her arm became swollen, and it was an allergic reaction to the red ink. It also can pose problems during the MRI. So there could be iron. This is a first-degree burn caused by an MRI machine just because of the tattoo. So here's other allergic reactions. It's crusty. It looks very unhealthy. It's going to scar. Between 2003 and 2019, Tattoo Inc. conducted 15 voluntary recalls. So 14 of the recalls had microbial contamination. And in 2018, 49% of the ink surveyed in the United States were contaminated with microorganisms. So this is just something to identify as like it could be problematic. And I'll talk a little bit about where the inks are going, like regulation of inks are going in the future. In 2012, there was a multi-state outbreak, non-tuberculosis. A skin infection produced a range of symptoms from mild inflammation to rashes and severe abscess. So here is a picture of illegal inks found in an establishment in Flagstaff. You know, there's a lot of artists out there who have quote unquote secret recipes for inks, you know, used back in the 60s. All of these are not allowed. They have to come from a reputable source, as in anything, you know, we need to have trace back. So here's where I was saying we'll talk about regulation of where it's headed. EU, European Union, is the only, they actually regulate inks. And so how they regulate them is they classify the inks as chemicals. Currently, right now, we are proposing to the FDA to regulate inks, and there is a large group of advocates speaking with the FDA saying, hey, this is something we really should look at and regulate, because especially if we do it under a cosmetic or permanent makeup, they might be more willing to start the regulation of these inks, and it really will weed out a lot of the bad companies and allow us to have more control of the inks that we're actually putting into people's skins. Tattoo removal. You could actually order this type of chemical and put it on your skin. It's pretty much an acid, and it just burns off the layer of skin to try and remove tattoos yourself. Also, tattoo removal is a really big industry currently. It's growing in popularity. However, it is not regulated because nothing is actually being placed in the skin. It's more using a laser to remove the pigments. So this is what happened after the hospital of the person trying to burn off their own tattoo. I do not recommend that. Let's talk about henna, henna tattoos. So henna tattoos, definitely, they're cultural. They also, I know my daughter who's 11 loves this, like, I want tattoos. And so henna is an option. The problem with henna tattoos is we don't know exactly what is in the henna. So it could be marketed as henna, but it also could have other ingredients that make them darker or stain the skin. So it's something that we should pay attention to, as well as maybe consider regulating. If we do eventually have regulation on tattoo inks, I think henna will be there too. Here is a bad reaction, just pictures of bad reactions to henna in regards to this. Obviously is a young child. So what is not approved by body art operators? Earlobe repairs. So a big thing is stretching out your earlobes. Operators are not allowed to actually repair this. This should be done by a surgeon. Branding, scarification. As I said, microdermal anchors are approved with variants. Same thing with suspension. We don't currently allowed. Branding is not allowed within Coconino County as well. What I am seeing, I know Phoenix has a huge tattoo convention. We at one time had a smaller tattoo convention up in Flagstaff, and also temporary events. So the same requirements are kind of adhered to within the facilities. It's funny, the picture below has a thing of toilet paper and of hand towels next to a hand sink. So same thing, you have to have smooth floors. It can't be in carpet. Have to have hand sinks provided and so forth. But these are really big in popularity in regards to people going to them and being exposed to tons of different artists that can provide body art or body modification to the clientele. Currently, body art mobile units are not in Coconino County. We don't permit them or allow them. However, they're gaining notoriety, and that would be somebody it's like mobile food trucks. So somebody driving around, they have the right facility, and they're doing body modification, doing tattooing out of these little vans. So this still, they have to comply with permanent body art regulations, and they have to have body art cards within Coconino County. So I still haven't encountered many of those. The gaps. So the lack of knowledge on part by the body art operator, as well as lack of knowledge on part by the regulatory authority. So there still is, I'm constantly humbled and always learning when I'm dealing with this industry. Technology changes all the times. And there's also a lack of scientific study about the effects of body arts, inks, piercings, implants, different infections related to body arts, and then long-term effects are really kind of unknown. What to think about getting body art? My grandma always said to me, "What's going to happen to your skin when you're 60? It's going to be wrinkly. That's going to be a saggy tattoo." But I'm still committed. A lot of people are still committed to it. Also, before going to get these procedures, am I in good health? Do I have anything that could prevent me from healing properly? So what are the motivations behind my decisions? A lot of people get tattoos with people's names, end up getting divorced. So these are all things to think about before getting tattooed. Tongue splitting, implants, what do I want to do to my body? How do I want to modify it? And then, do I feel comfortable? So making sure you're comfortable with the body art, the actual place you're going to get the tattoos. So again, what to look for when you're inspecting. If I were walking into a studio, I would definitely want to notice how clean is the floor, how clean is the equipment areas. These are all really important. Conclusion. So the human body is very resilient. Make sure you know the risks before getting tattooed and pierced. Educate yourself. Informed risk. So just everything's a risk, of course. Commit to taking care of your body art. And if an infection develops immediately, seek treatment from a doctor or contact your local regulatory authority. And I'm going to end with the Bird Box Challenge. So back in the day, I know I'm dating myself, but MTV had a show called the Bird Box Challenge. And within this facility, they would have somebody show them a picture, and then the artist would blindfold themselves and try and tattoo the picture as close as possible. And so this was a big fad. I think it has now fizzled out, but I thought it would be just pretty funny to show y'all, because this is something that actually occurs in our society. So this is how mainstream like body art and body modification is becoming. And questions?
Awesome. Thank you for your presentation. We do actually have quite a few questions for you.
Okay.
We'll get those pulled up. Not gonna be doing the Bird Box challenge anytime soon.
No, thank you.
All right. First question is why don't you guys allow branding or suspension?
So for branding, as I said, you need a certain type of like ventilation system. And it is a very limited, I would say specialized group of people that actually perform branding. So currently in Coconino County, we do not have anybody who does branding or suspension. Suspension, you see more at, like, as I said, like Jane's Addiction and concerts like that. But we just currently don't have anybody who does it or would like to. I think if you would like to do that procedure, you would probably have to fill out a variance.
Okay, so there's like an avenue that they could potentially go through.
I would think so. It just hasn't been done in the past.
All right. Which body art procedure takes the longest to heal? Does the person need follow-up medical care to ensure no infection?
So in terms of what procedure, it just all depends. So tattoos, people can have sessions that last 9 hours and tattoo half their bodies. So that obviously is going to take weeks. Piercings can take months to heal. It just depends where it's located or how big it is. And does the person need to follow up with medical care? It depends. It depends. If you're seeing infection, absolutely.
Perfect. Are the ingredients in body ink harmless to the human body? I think you touched on that one a little bit.
Yeah, unfortunately, we don't know. So, as I said, nothing currently is being regulated in the United States in regards to ink. So it is user discretion. So yes, there are reputable companies, but they still do not disclose exactly what's in the ink. Even if they say organic, you have no idea.
Always frightening.
Yeah.
Must operators hand wash before piercings? Noticed when I had mine done, as with food, just donned on gloves and moved along. Just thought it was curious.
They should be, yes. In between, same thing with like changing gloves in between food, tasks. Piercers and tattooers should be doing the same thing, is wash your hands in between changing tasks. It's best practice. Now, do they do it? Who knows? Probably not.
I think everybody that works in food safety can kind of empathize there.
Yeah.
Next question is, you mentioned suspension is not allowed. Is there any kind of follow-up or enforcement procedures if you find out something like suspension is being performed?
You could probably just put in like a complaint, but it's really hard to enforce. We've had some complaints come in regards to crazy body modification, like cutting away people's genitals and things like that. But unless you visually have proof, like there's nothing really the health department could do. Now, that's not to say that maybe we could take it to a different avenue for enforcement. But currently you can put in a complaint, we can investigate, but unless we're seeing it, it's really hard to enforce.
Okay. With the new code, would they need to adapt to the bigger square footage, or can they be grandfathered in as is?
It depends where you're regulating. So that's something like Coconino County would have to determine, are we going to grandfather this in? Obviously, for any type of new builds, they would have to adhere to the new code.
Okay. Does the regulations consider any of the non-reusable equipment / utensils as a biohazard?
Yes, I mean, so even when they're wiping away the procedure area, they're bloodborne pathogens, right? It has ink as well as blood from the person they're doing the procedure on. So the trash can lids have biohazard, but currently we don't have anything that says they have to incinerate it or actually treat it as biohazard waste. So they can actually take that, wrap it up, and throw it in the garbage can. And non-reusable equipment is definitely biohazard, and so that's why those clean rooms, or they're actually dirty rooms, are separated from the actual facilities in which they're doing the procedures. Does that make sense? Did I answer the question? Oh, they can't answer back, huh?
Makes sense to me.
Yeah.
Who tests to make sure equipment is properly sterilized?
The third party. So whoever they're sending like the spore test away to, the third party determines, and it's done on a monthly base, and they have to have a log that's kept on premise.
Perfect. Any extra requirements for operators that perform body modifications in genital areas?
Goodness gracious. No, that's the really scary thing, is that if you're getting some type of piercing on a genital, like, you want to go to a reputable source, because currently in Arizona, there is no like schooling. I know in a lot of other, like Oregon and Tennessee, they actually have to have like continuing education, like where they're doing classes in order to be certified to pierce, which is, I'm hoping, where the state of Arizona can move towards that, because we want people performing these procedures to be educated.
Definitely makes sense.
Yeah.
How can you tell if inks are from an unapproved source?
Most inks you're looking for is going to be labeling. So everything's in the labeling, including batch numbers and things like that. But you can tell if ink, like the homemade inks that I saw within one of our facilities, I knew the guy, it was like in a plain bottle and he had made the label. So I asked him, he's like, oh yeah, I made it myself. So it's it's really important that you know what questions to ask when you're in these facilities.
Definitely. Did a specific event happen in Coconino to spur the regulation of body modification?
No, we had an amazing environmental health director who did this prior to me coming on board. I think it was like back in 2001, 2002, and she spearheaded it. So I'm thankful that we have people like that are like, this is something that should be regulated.
Definitely seems like it is. Somebody wants to know, do you have any tattoos or piercings yourself?
Yes.
Are there body art schools where people can go to get trained properly?
Yeah, as I said, there is, what I've heard of from NEHA, there are a couple places. I know Colorado has pretty strict regulations, but I know in Oregon for sure that you have to go through some type of training before you can even pierce or do like tattooing on humans. So
For the most part, currently it's like apprentice based, right?
it is apprentice based.
Okay.
But even that, we don't require a certain amount of hours, in which I think we should. Like it should be, you've done apprentice for 3 months. But currently, nope, all you do is have to pass a body art card, like a test.
Okay.
So, yeah.
Does the state intend to do similar regulations?
Don't know. Because Maricopa, you guys have a beast. That would be a beast of regulation down there.
Oh, absolutely.
Tons and tons of studios.
That would require a significant workforce, I think.
Yeah.
Is there a medical questionnaire for the studio clients to perform? Wait, sorry. Is there a medical questionnaire for the studio clients to perform and the studio to file? Is there a physician review of the form for the studio?
No, is it so for when you're getting procedures done, everybody should fill out when you're first filling out a waiver, which is kind of protecting the body modification studio. On that is they ask you a series of questions like, do you have a skin disease or do you have a compromised immune system? Things like that should be asked on the questionnaire prior to getting the procedure done. And then the physician review of the form. No, the physicians don't review any of these body modification forms because they're in a different, it's a whole different beast. Physicians have years and years of schooling where tattoo artists could apprentice for 3 months and go at it.
Okay.
Yeah.
Perfect. The questions keep rolling in for you. What is the wildest thing you've seen while inspecting a tattoo shop?
I don't know. I haven't seen too many wild things, obviously, because when you're in there regulating, they're going to be on their best behavior. But I mean, probably a homemade tattoo gun or machine. Sorry, you can't call them guns anymore. So homemade tattoo machines and, like drug paraphernalia where you're like, no, I don't think so.
The next question is, do clients provide medical approval?
I'm confused on that question. What do you mean, like medical approval? Like you are, if you're going to get a tattoo, you are signing a waiver saying, pretty much saying, I'm putting my body in the hands of this artist.
Okay, that makes sense to me.
Yeah.
Is there a government registration or a state/national professional qualification?
NEHA, actually, when I was just out in New Orleans for a food conference, they are providing a training. So it's amazing. Eventually, we're taking that training and we're going to put it online. So I think it would be offered to anybody who wants more information, or if they're going to do regulation on it. It's like a class. So I'm pretty excited about that.
Definitely sounds interesting.
Yeah.
Let's see. This one says, not sure if I understood. Do tattoo parlors have to have a certificate of health displayed in the place of business?
Yes. Yes, they have to be licensed just as a restaurant does. They have to apply for a license prior to opening doors.
Perfect. And then last question that we have at the moment, are your inspections online for the public to view?
No, but you can email me if you want to know. No, all of it is, our inspections are public record. So as long as you fill out like a disclaimer, public records request, you should be able to access that information.
Perfect. All right. In that case, that
Cool.
seems to be the end of the questions. We just want to thank you, Wendy, for coming in and for sharing your very interesting and awesome presentation with us today. And thank you for your time.
You're welcome. Thanks.